the COMBI-d data is highly controversial, and it's not really clear whether or not this is a scientific or a drug-specific issue. So the preclinical rationale for combining BRAF and MEK is that BRAF inhibitors paradoxically kill tumor cells but activate the normal cells in your body, and by adding the MEK inhibitor, that actually blocks that normal activation. And so the initial clinical trial showed that combining the two seemed to work much better because the endpoint that they initially used was response rate and progression-free survival. Now, when you continue to follow the patients further, that now is starting to not look as good. However, the question really is that because the Glaxo drugs just don't look as impressive, whereas what about, so Genentech has vemurafenib and they also have cobimetinib. What is their combination going to look like? And Novartis has LGX-818 as well as binimetinib. And what is their data going to look like? And we really don't know yet. I think conceptually, from a scientific perspective, we would all think that adding BRAF and MEK together does make the most sense, but it may turn out that that's toxic, because in the GSK trial, we found that there was a significant increase in an unusual toxicity of fevers that patients experience. And those can actually be very difficult for the patient to tolerate. You can just imagine having a fever every single day. You just get exhausted eventually from having that. And so patients have had to come off the treatment because of that, which will then affect the progression-free survival and eventually the overall survival. Now, the other companies' combination inhibitors don't have those same issues. So how will that play out? We really don't know.